Kiet went from this child who was up and ready to go in the morning, bright, where's my breakfast, good morning, Mom, to, I mean, there were some days that I would tell my sister he's like a zombie. He's, you know, he's having so many seizures at night that he wakes up exhausted. And he's sleeping 11, 12 hours a day, you know, and he would go to school. And, you know, Kiet went from a 3.8 grade point average to a 1.2, a 1.6, a 2.1. You know, still trying his hardest, still in class. He would literally get up and excuse himself to have his seizures because he knew when some of them were coming.
My friends, well, if I had seizures in front of my friends, what they would say, "What are you doing?" And then I'm saying, and then after I was finished saying I had a seizure.
Everything that I was supposed to do, I was doing, and they just kept on coming. And so it's like, you know, when I sat down, my statement to my neurosurgeon was, I know I'm not asking for a miracle. I'm not asking you to take them all away. I just want him to have good days and go months without him. And, you know, I could live with one a month. You know, he was having anywhere from 6 to 7 a day at one point. You know, and then we went and we did the overnight thing where they hooked him up and they took all his medication away, and he was having hundreds.
I felt uncomfortable around everyone.
We will, at Children's Oakland, have a very thorough investigation into a patient's medical history. We will look at all of the medications they've been on, what kind of seizures they have, how frequently they're happening, how they manifest themselves, day, night, what time of the day it happens. All these details go in to the thought process, and ultimately we need to answer the question: is there a surgery that fits this profile? Is there a surgery that can help this child?
They all knew and studied Kiet and knew what. I mean, he walked in and he said his first thing to us was, you know, this is my first time meeting you, but I know you. I know Kiet. I know inside of his head already. I know. I've looked into this. I went over this, and I mean, as a parent, it's wonderful not being a chart number. It's wonderful not being an insurance card, or it was wonderful to know that he genuinely cared about Kiet and about my feelings and about how I felt about it, and made sure I understood what was going on. I sat down by the doors and I wouldn't get up. And I told him, I remember telling him, just bring him back to me. You know, I understand if you can't fix him, just make sure he comes back.
We can take a child whose life is completely derailed by seizures, whose childhood is oftentimes ruined because of how frequently they're seizing or because of the side effects that the medications have, and we can give them back that childhood.
It is the scariest and the biggest decision of your life, but to see your child wake up and not seize and walk in your child's bedroom and not look at him like he's just finished having a seizure or he's gonna have a seizure, see him doing typical boy or girl or children's things is wonderful. It brought me a sense of peace. It's 5 months out of surgery and my child's in school at grade level, not sleepy, not taking naps in school anymore, not excusing himself to have a seizure. It's incredible. What this surgery has done for Kiet is nothing less than a miracle.
Changed my life at school. I don't have to hide the seizures because I don't have any seizures anymore.